Good morning and welcome to this snowy, I guess not snowy yet, this icy, I guess not icy yet, this rainy February morning. And today's February monthly member briefing. I'm Thomas Deere, I'm the Vice President of Sales and Engagement at the Chamber, and I have the privilege of being your host today. I want to give a big thank you to each of you for joining us today, and I want to thank you for your partnership with the Chamber. These sessions are designed to provide you with information, solutions, and connections needed to keep your businesses thriving. Today, you have joined in listen-only mode with your microphones and cameras muted. We do encourage you to ask questions and make this interactive throughout the program by using the Zoom's chat box. I also want to thank our media sponsor, the Cincinnati Business Courier, for their support of our monthly member briefings. We have an incredible lineup today. I'm excited for you to hear our guest speakers, so let's get going. Please welcome Jill Meyer, President of the Cincinnati USA Regional Chamber.
Thank you, Thomas. Good morning, everybody, and welcome to our first member briefing of 2022. Getting a February start this year as the beginning of the new year is that first week is a little spotty on where people are and what they're doing, but we're so happy to be all back together. As Thomas said, there's something that's supposed to fall from the sky today. And so I suspect that most of you, like us at the Chamber, are working from home today. And you know, a few of us were chuckling about this yesterday when we made the call to close down the office and ask everybody to work remotely. Remember when a decision like that would have just sent everybody spiraling? The notion that in a moment's notice, we just all picked up and started working from home without missing a beat is, it's a lot of things, but maybe we'll just call it a silver lining of the pandemic experience. Anyhow, more exciting things are happening in our city. As I know you are all aware, I don't even have to say the words because you're all saying them to yourself right now. Who day? How incredible is this? The past few weeks, you know, I'm sure most of you watched the game. If you didn't, you missed some great entertainment, and you'll watch the Super Bowl for sure. But the amount of yelling like a banshee that I've been doing through the playoff season has been crazy, and really just a welcome change in our normal football season cheering. So go Bengals. You may expect that when our Bengals are in the Super Bowl, not only are we excited along with everybody else in the city. By the way, the orange glow throughout the city for the past few weeks is something special to see. So make sure you get a peek at that. But we at the Chamber are doing our share to make sure we keep that energy going and to make sure that all of that additional mentions of Cincinnati and people hearing Cincinnati and thinking about Cincinnati, that stays high on their radar, and we're making sure that they see the best Cincinnati that they possibly can see. Stay tuned. We are working with partners with our city and the county and the Bengals, putting together some cool stuff for the rest of the community to really lean in and celebrate and make this fun. So stay tuned. I'll tell you, there will be a party as part of this, at least a party. So stay tuned as we all cheer on our Cincinnati Bengals in their Super Bowl march, which they will win, and we will then be celebrating not just the appearance, but the win. One more quick thing before we get in, because not everybody is a sports fan, but hopefully if you're not, you love a good party. And hopefully all of you know that February in the Chamber world is our annual dinner. It is the biggest business annual event of the year. And we are coming back this year. Last year, we didn't do it because of COVID, and we are back on February the 24th. It's the last Thursday of the month. Mark your calendar. If you've been to this, you know it is the biggest networking event in the city, or in the community, really. There'll be a cocktail hour ahead of time, entertainment. We'll roll out the fancy centerpieces. We have a great dinner. And most importantly, what that dinner is about celebrating some pretty cool people in our community. We have two categories. The first, and what we've been doing for a really long time in this community, is recognizing great living Cincinnatians. This year, we're honoring Dr. Charles Dillard, Donna Jones Baker, Jean-Robert DeCaval, and Roger Howe. And we will celebrate this year's 7 Making Black History honorees. It is Black History Month. I hope you are all celebrating it in special ways to you and your colleagues and family. We start by celebrating people making Black history today. And we've been doing this for the past few years. We we'll roll out a celebration of a different person. I'm gonna get this wrong as I say it, but I think it's every Tuesday, Thursday through the month of February. On Tuesday, our first honoree was rolled out. So check it out, Cincinnati.com or the Chamber's website, but we will celebrate our Making Black History honorees at the annual dinner as well. So come, bring your friends, bring your coworkers. This is one that they will thank you for turning them on to, and our team is really happy to help you get a ticket, get a table. If you want to sponsor it, even better. But come play with us that night. We will be following CDC guidelines. Our guest keynote this morning will be happy to hear that. We're taking all the precautions, and there's everything about that on our website. We want to make sure that we keep everybody safe while we celebrate. So that is enough out of me, because who you really came here to hear from is our keynote speaker this morning, who frankly is one of my favorite people on this planet. Debbie Hayes is the president and CEO of the Christ Hospital Health Network. I bet you know her story, but it never gets old reviewing Debbie's journey. Listen to this. She joined Christ as a student nurse aide in 1987, then became a critical care nurse. And then over the next 25 years, she progressed through a wide range of leadership roles, including clinical nurse manager, director of critical care, chief nursing officer, chief information officer, chief hospital officer, chief operating officer, and now the CEO. And I think you can just hear that and get that this is a CEO who totally understands her business from every angle and every nook. And we in the Cincinnati area are the beneficiaries of that. Over the past 2 years, Debbie has been one of the leaders in the healthcare community, instrumental in leading not just Christ Hospital through the COVID-19 pandemic, but really all of us, and ensuring that our whole community continues to have access to the safe and exceptional care that we've all come to rely on at Christ Hospital and beyond, at Christ for over 130 years. So it's quite a legacy that Debbie is carrying on and building into there. In their spare time while they're fighting and leading through the pandemic, she's leading them through their 5-year strategic plan, which launched coincidentally in early 2020. So Debbie has had her hands full and then some. A little closer to home, Debbie is a member of our chamber board. We are so fortunate to have her leadership helping us serve you. She's a committed civic leader in many, many other endeavors and is a dear friend to me, which I'm so grateful for. Debbie, thank you for taking time from another long, crazy day. This day is crazier for hospitals than it is for the rest of us who get to stay tucked in safe at home. But thanks for taking time from another long, crazy day to spend it with us. We are so glad you're here, and the floor is yours.
Great, Jill, thank you. And gosh, thank you for that introduction. As Jill said, I'm a long member of this community, and I'm going to move to the side just for a minute for those of you that can see it, because for the first time in the history of Christ Hospital, we have lit the tower orange. The only other time that our tower has changed color is during February. We always like the tower red during Heart Month, which we started in February, but we decided in support of the Bengals that we would turn it orange until we win the Super Bowl. And then we'll turn it red after that so that we can not only celebrate a Super Bowl victory, but also celebrate Heart Month. And I'll talk a little bit about that maybe later on. But I think one of the reasons that you may have wanted to hear from me this morning, and again, you can't get away from it, is related to our pandemic. And I am happy to report that it appears that the predictions about this what I will call the 5th surge are coming true. So about a week ago, This community, much like communities across Ohio, were reaching their peak related to hospitalizations with the coronavirus. So just to put it into perspective, back in 2020, when all of this started, the prediction was at worst case that this community would see about 1,000 patients in the hospitals. We never really saw that. We saw about 850 patients hospitalized at any one time. So when this fifth wave started, we continued to think about what that would look like. And really and truly, because of the manner in which this Omicron variant and its transmissibility became apparent, those numbers were really not contemplated to be any less than the original surge. And in fact, what ended up happening is our community topped out at about 1,020 patients in hospitals across this city about a week or so ago. That is a 35% increase from what we actually saw in 2020. And so first of all, I want to say thanks to everybody here in the community, because when we came back to the community several weeks ago and said, please hearken our cries, we need your help, it is very apparent that those requests for assistance across the community happened. The good news is our numbers are now down to about 800 patients in the hospital. And so we have now seen the peak of that wave. And much like the rest of the country, there are only 2 states in the country right now that continue to have increasing numbers of hospitalizations and positive testing. We are clearly on the downswing for what I think is hopefully the end of this fifth wave. Now, where that will end up, we don't know. And as Jill said, I am going to continually encourage everyone to continue with the safety practices that we've all put in place over the last, 2.5 years, so to speak, wearing masks, social distancing, and really encouraging people to get those vaccines and their boosters if they are eligible. Still in this community today, there are only 61% of the community is fully vaccinated, and it's very difficult to tell who's gotten their boosters, but percentages wise, we think that based on the best data that we have, there's only about 30 to 40% of the community who is vaccinated with 2 shots that have actually gotten their boosters. I would tell you that our infectious disease specialists have told us that this is not the last wave. There is some level of endemic prevalence now, but there is no hope that there will not be other waves. Now, will they be as great as this last Omicron wave? We certainly don't know that. And this virus has obviously thrown a few curveballs over the last 2 years. But I suspect that we will have additional waves, probably quiet down in the spring as we start to go outside again. And then my guess is next fall, we will see some level of, increase back there. And so we are trying to figure out, based on the best scientific data that we have, what that might look like in the coming months. The one thing I would say again is we all need to understand that this virus is not going to go away until there is a great deal of folks who are vaccinated. Much like we see flu seasons, our infectious disease specialists tell us that at some point this will become like the flu, and every year it is likely that we will need booster shots, just like we get a flu shot every year to try and reduce the incidence of flu in the community. But I would just, again, like to echo Jill and the rest of our teams here at the Christ Hospital Health Network. This community has come together and really embraced those things that we are asking as healthcare providers to try to keep this community safe. I would encourage all of you and your businesses to continue to sing those songs and really be, advocates of those safety practices, because that is the way that we will keep businesses open. It's a way we will keep this community vibrant, and it's a way that we will try and, reduce the burden that everyone has related to this virus that none of us could have ever expected. And so with that, I will stop and maybe take a few questions.
Great, thank you, Debbie. And I neglected to say earlier, if you have a question for Debbie, if you will pop it into the Q&A, I will grab it from there. If you have it in the chat, I can't promise you that I will find it. So Q&A would work great. But while we're doing that, Debbie, I have a few questions that were teed up when we knew that you were the speaker. And one question that I know is common conversation in various different circles is what the pandemic enabled hospital systems to do in a moment's notice, that perhaps even in your 5-year strategic plan, perhaps you were considering what telemedicine may have been by the end of that 5-year plan. I wonder if you can tell us what Christ's experience has been with telemedicine and maybe other opportunities that we pulled out of pandemic that maybe will forever change the way that Christ serves its patients.
You know, Jill, that's a really great question. And so you think about what's happening today, right? So we're all about to undergo a snowstorm. And traditionally what we would have done at 5 o'clock this morning is we would have called, everyone together and said, what are we going to do? And today, instead of, yes, we're going to close, it was, we've already called our patients and we've converted most of them over to virtual visits for the day. And, I always think about crises, right? So there are always bad things that come out of a crisis, but there's always good things that come out of a crisis. And it really forced all healthcare providers across this nation to really try and transform the way that we have provided care. And so during the early days of the pandemic, because we had to, there was no other way to provide care in the outpatient space. We had really about 50 to 60% of our patients were doing virtual visits. Others were obviously using the emergency room as they needed to. But now it is an option every day for patients to use virtual telehealth, whether it's a virtual visit like we are doing today, whether it is phone triage, and clearly it has caused us to use technology to transform the way that we are delivering care, specifically in the outpatient areas. In fact, we are even exploring right now, we have a partnership with a company that was actually started here in Cincinnati, and we are doing tele-physical therapy so that patients who come and need a knee replacement or a hip replacement, that our therapists can actually watch them from their homes and determine whether or not they're doing their exercises correctly from their home. And then if they are, great, they can stay at their home and do those exercises. If not, we ask them to come in for some additional, remediation with the physical therapist hands-on. But those are the kinds of things that we found to be extremely beneficial and have accelerated our adoption of those technologies across the health network.
So related to that, because I had this thought on Monday of this week, I was at Christ at the medical office building for my mammogram. And as I was walking through the halls of the medical office building, the thought was in my head, and I wonder if you could speak to it. Hospitals have to have a lot of space for a lot of different kinds of patients. And it seems that in and around Christ, I think there was some street construction going on, but there's always something new that's coming online. When you look at the impact of telemedicine on hospital space, are you able to, does that open up opportunities to view your physical space differently? Or do you still need all the same space because there's always going to be that need even with telemedicine as an option?
Jill, that's a really good question. So as we have, developed our outpatient centers, what we had tried to do, especially in the ones that are more recent, is really to make those spaces much more amenable to adjustments as we are going forward. And what I anticipate is that the physician office, so to speak, of the future will look very different than it looks now. And that footprint will be somewhat reduced in some areas, but there will be opportunities there for more robust telehealth visits, right? And so over the next couple of years, we will begin to assess that and then determine what our actual real estate footprint might be, not only for the clinical space, but I have to be honest with you, much like all of us, a lot of our, what I would call support services, such as finance and IT and, those kinds of things, we have a very robust work at home policy. And if the work gets done and it works for the department and we can meet the goals of the organization, we've been very flexible with our staff to allow them to work at home.
Great, great. Yeah, it's evolving so quickly that those of us who dip into it only every once in a while, fortunately, there can be enormous changes for us from one visit to the next. So 2 questions related to this, but in 2 very different directions. The one is, you referenced this, when the pandemic happened and nobody knew up from down at that point, something pretty special happened in the Cincinnati community with our healthcare community. And I think that too few people have an appreciation for, 1, how you guys all came together, but 2, how very unique that was across I'll stick with the country. I'm sure it was unique around the world, but unique across the country. Can you share with our members just a little bit of the insight of the how and the why that partnership came together that really did keep our community so well protected?
Yeah, thank you, Jill. Years ago, we had an organization called the Health Council here in Greater Cincinnati, and it was made up of all of the health systems in the Greater Cincinnati community, and quite frankly, as far out as Adams County, Batesville, and some of our rural partners in the Greater Cincinnati area. And that organization has evolved into what's now called the Health Collaborative, and all of the health systems participate in the Health Collaborative. And so, Jill, to your point, it's very unique in cities of our size to have such an organization. And literally, although each of us obviously are competitors in our own right, we frequently get together to talk about things related to the health of this community and how the health systems can participate to try and improve the health of the community overall. And so during the pandemic, literally every morning almost, all of the chief operating officers and the chief medical officers of the systems got together to really understand what the needs of the community were, how we could collectively support the communities and to support each other, even as far as transferring patients to and from, within and outside our systems to help balance the load so that no one health system was overburdened, but yet so everyone in the community could get their care. That is not an unusual situation in Greater Cincinnati. It is extraordinarily unusual across the country. There are only about 6 or 8 of these such organizations that are still, together. And I clearly think that it differentiates Greater Cincinnati from many other cities.
Yeah, thank you for that. I can tell you from the chamber lens, and I think everybody on the call can still conjure up those early panic-stricken phone calls of what do we do now? I can tell you that as we at the chamber pulled together our work in our Restart Task Force and really tried to lean in to make sure that our businesses, and in particular small businesses, had resources, that partnership among our hospital community was a lifeline for us. You guys were constantly giving us information, helping us think through practical challenges. And we at the chamber appreciated how special it was. And I think too many outside who were rightfully fighting their own challenges probably didn't have a glimpse into just how really cool that partnership was and how much we all benefited from it. So thank you for that.
Sure.
The other question related to it, which is in a different direction, is so you started 2020 with a 5-year strategic plan, and then the pandemic was dropped in your lap. As you look forward, are there, I don't know, a couple things that either changed because of the pandemic or maybe not? Maybe they were built into your strategic plan and they're still on track, but any things coming down the pike for Christ that you're excited about that you can share with us?
Yeah, I'd love to. So one of the things that we've been talking about is how do we really personalize the care that patients receive in this community? And so we have a program, it's called our Precision Medicine Program. And it's really all about how do we use individuals' own genomes to determine what is the best care for patients. So let me give you an example. Any woman who makes an appointment at one of our women's imaging centers to get their mammograms, Jill, just as you talked about, will now get a little message on their phone from a chatbot that we've developed that when they answer those questions, it will help us determine their risk of cancer based on scientific questions that you answer in your family history. And given those scores, we will then make referrals to our genetic counselors so that women can make determinations about their particular treatment options, or we will have them go to our breast cancer screening clinic. Now, that is just one piece of precision medicine and genetic testing. There are other ways to use precision medicine to really specialize the care on a personal level, because there are about 170 medications that are pretty common in the industry that all now have indications for genetic testing. And so we are starting to use this in our primary care offices so that patients who are on multiple medications, we suggest genetic testing for them. And then based on the results of that genetic testing, their medications are actually, the dosages are either changed or they might be changed to a different medication to maximize the effect for that individual based on what their genes do in relationship to how they metabolize those medications. Anything from, simple things like medications for depression, to heart and vascular medications for blood thinning, to quite frankly, and we're now actually using this as part of what we call our opioid sparing programs to try and reduce the amount of narcotics that patients need post-surgery for pain control, because your body metabolizes those drugs very differently. And if we can determine what the best dosage is, then we can make sure that you get the least amount of narcotics, but get the maximum benefit from it during those post-op surgical recovery periods. And so we are very excited about the precision medicine program. It is growing by leaps and bounds. We've now put pharmacists in all of our primary care offices so that we have pharmacists consulting with our physicians to try and help them maximize the potential related to patients' medication therapies.
That's mind-blowing, hearing the enormity of that. And we have just a few minutes left, but a question has come in, and it includes a question that my brain went to immediately. Jessica Rummer asks, is precision medication covered by insurance and equitably available? And my question that I was going to follow with, maybe you could answer these together, is as what we already knew and learned, underscored, unfortunately, multifold through COVID, is the lack of equitable healthcare across the community. So does precision medicine help us get that right? And if not, are there other things that you see really happening, coming online, that Christ is doing to make sure that equitable outcomes in healthcare are a bigger part of our conversation, so that we do not continue to have our Black community members having worse health outcomes than our white health members?
Great question, Jill. Yes. So based on the scoring that we do, precision medicine is covered by many insurance companies. It is covered by Medicare and Medicaid based on some of that scientific scoring. And because we understand that health disparities are something that we absolutely have to address as a healthcare system, we have gotten hundreds of thousands of dollars worth of donations from very generous donors so that we can help cover the cost for those that can't afford it.
That's wonderful. Lots of big things still happening, even while fighting on the front lines to keep us all safe from the COVID virus.
Yeah, and if I could say, I know we don't have much time left. It is Heart Month, so please, everyone, the American Heart Association works with the Christ Hospital Health Network to make sure that we are constantly thinking about our heart health. It is still one of the top killers of people in the United States. And for women, it's 1 in 3. And we need to do better at managing that. So please check your blood pressure, make sure that you're eating healthy, and get your exercise, and see your physicians on a routine basis.
And tomorrow is National Wear Red Day. So wear
It
red
is.
tomorrow on Friday, February the 4th. I know what a Bengals fan you are, Debbie. In parting, perhaps we get are you going to watch it? Are you going to LA or are you watching it at home?
I'm not going to LA. I'm going to watch it from home, and we are going to win.
I was going to say, all right, I know the prediction, but I know what a fan you are. So thank you for lighting Christ as one of those orange glows that we are all enjoying from so many different angles. Yeah. Debbie, thank you for taking the time to be with us, but really thank you for your leadership across the board. So many important things happening at Christ, so many important things in our healthcare community that impact all of us daily. And I know I speak for many when I say we all rest a little easier knowing that you're at the helm at Christ.
Oh,
Thank
Jill,
you for being with us.
Thank you.
Bye-bye. Thomas, over to you.
Thank you for all you and Christ Hospital Network does for our region. Debbie, you're a true leader, and we sure appreciate having someone like you running the ship. So thank you very much for your time today, and thank you for your insightful comments.
Thank you.
Switching gears a little bit, it's my pleasure to introduce 2 chamber members who have been making an impact in the community. This morning, you're going to hear from Jorge Perez, the president of the YMCA of Greater Cincinnati, and Chantel Thomas from a Sound Mind Counseling Service. First up is Jorge Perez, president and CEO of the YMCA of Greater Cincinnati, and he's part of the Leadership Cincinnati Class of 42. Jorge is the first Latino American to lead the YMCA of Greater Cincinnati in its 164-year history. The YMCA operates 14 branches, 1 overnight camp, and 80 childhood learning centers across our region. They offer programs and service that nurture the potential of every adult, every children, promoting health and well-being. The YMCA of Greater Cincinnati is a complex, multi-branch organization that serves over approximately 140,000 individuals. Welcome, Jorge.
Thank you so much for having me. I'm excited to be here and to continue the conversation about health in our community. Behind me, I've actually put a slide that I think highlights some of our work. And what I want to do is just spend a couple minutes challenging the people on this call to lean into their health. We heard earlier from Debbie about what we're doing to get people healthier. One of the things we have to, and one of the things the pandemic taught us, is that we ourselves have to be on a wellness challenge. At the YMCA, we help individuals achieve goals, make friends, and connect to a cause bigger than themselves. So it's not just a fitness center. And although we do a number of programs, actually there's a list here over my shoulder, everything from fitness to childcare to swimming, senior work. Some of you went to our resident camp. Everything we do is tied to this idea that if we create environments where people can grow and develop, they can develop lifelong and health enriching experiences. And so I want to end my comments to really challenge you to think about joining or starting your own challenge. If you're like most Americans, your goals for this year are already kind of on the are in trouble. And so they're on the screen, and I just put in the chat, you can join a 21-day challenge. It's free. You don't have to do anything. We'll give you access to all of our online experiences. If you're already a member, this is a way for you to get going this year. But all you have to do is text a reset to the number on your screen and in your chat. And we'd love to have you and encourage you to get healthy again. The YMCA has leaned in different ways in the lives of people. And one of the things we talk about when we think of the YMCA is how cradle to end of life we are. We have individuals that start with the YMCA as infants, and they're still swimming on swim teams at 89 years old. And so we want to encourage you to make health and well-being a lifelong journey and to consider doing it with the YMCA. Thanks.
Jorge, that's terrific. And to echo what you said, the YMCA is such an important part of our community. I know I've personally had experience with different YMCAs across the tri-state region, and every time I just come away, it's just amazed at my experience, and I'm more amazed at what I see going on. As Jorge said, it's not just a couple single activities, it's from cradle. Jorge, how did you say that? Cradle to?
All the way to the end of your life.
All the way to the end of your life, and it's so true. And 21-day challenge for free to get you jump started on a brand new you. Man, I tell you, reach out to Jorge and his team at the YMCA. That's an awesome opportunity. Thank you, Jorge.
Thank you.
Next up is Chantel Thomas. She's the president and CEO of a Sound Mind counseling service, and she also is part of Leadership Cincinnati Class of 42. Now, being part of Cincinnati Leadership Class of 45, I congratulated Jorge and Chantel for being part of the second best class that we've had come through the Leadership Cincinnati. I'm teasing them, of course. Chantel received her doctorate from Kent State University, and through her achievements, one of the most important is she's been selected as one of Cincinnati's leading women. A Sound Mind counseling service is a private practice staffed by behavioral health clinicians who are committed to providing quality therapy to people of all ethnic and cultural backgrounds. The increasing awareness we see of mental health is becoming more prevalent in society and today's media. The more informed we all are about mental health concerns, the better prepared we can be to make good decisions to seek out those who can help us achieve a sound mind. At a Sound Mind counseling service, you're more than a client. Their goal is to develop a relationship where you feel safe enough to achieve total mind, body, and spiritual wellness. Welcome, Chantel.
Thank you. And I just wanted to say, everyone, we all are experiencing this pandemic, and it's a universal thing. The whole world is experiencing it. So I wanted to take my few minutes, since you heard about the practice, that I think that's a lot said there, but I wanted to take just 1 minute to have everyone participate in a breathing exercise. It's just 7 deep breaths. And since we're all leaders in our companies, I would like you just to take this opportunity to take a deep breath. And the reason why there are 7 deep breaths is because 7 deep breaths will help bring your stress level down by up to 50%. So you can do this wherever you are. And right now, we're going to practice it. And that will probably be the most of my presentation. So you want to make sure you're sitting flat, that your feet are flat, nothing's crossed, arms are relaxed. And if you can close your eyes, although I can't see most of you, you take the deep breath in through your nose, chest should rise, you hold it for a count of 2, and then let it out slowly through your mouth. So let's do that again. In, hold, release, 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 and last one, in, hold, and release. All right, so you all have just brought your stress level down by up to 50%. real fast, real simple, something you can do with your kids. You can teach them how to breathe before they perform or take a test at school. Also for yourself, before you get up and start work, just breathe. The first 7 minutes of the day, the last 7 minutes of the day are the most impactful in your life. If you start out with the hustle and bustle and going very fast, that's what your day will be. If you start out very calm, breathing, and relaxed, that's what your day will be. So at Sound Mind Counseling, we teach people how to relax, how to manage the depression, stress, anxiety that's taking place every day in our lives, especially with the pandemic. It has gone up. Divorce rates have increased. Substance abuse use has increased, domestic violence. And so right now, during this pandemic, we all need some extra help. So that's what we're here to do. I put the information in the chat box there, the website and the phone number, and we can help with any crisis you experience. My team is trained in crisis intervention and trauma. And so we're dispatched all over the world for mass shootings and downsizings or even robberies, bank robberies. So again, we can help on a bunch of different levels. And thank you so much for having me.
Chantel, I have one question. Do you work with teams or do you work with individuals?
We do all. We do work with teams. We do corporate trainings and speakings, and we go to a lot of places around here and work with the. Did you say teams? Correct? Or
Teams, yes.
Yes, yes. So we do trainings for a lot of different corporations here. How to manage anger in the workplace, how to deal with coworker relationships. So it just depends on what the need is, and we provide group services as well.
Fantastic. Thank you so much. And I think when we all get to work, we're running so fast to get there. We're running in, we're trying to get that computer going. We're trying to get to the next meeting. And you're so right. If we could just take a few minutes, and thank you so much for just that simple breathing exercise. It is very calming. It is very centering. And the reminder is true. What a great way to start the day. So thank you very much for your time today. I want to thank these members for being part of our monthly member briefing. If you are interested in being part of the monthly member briefing, please go to cincinnatiChamber.com/monthly member briefings and submit an interest form, and I'll be sure to reach out to you. The Cincinnati Regional Chamber has a total of 10 benefit partners that enhance your business on an everyday basis. For our benefit partner today, we're excited to have Louis Hallmeyer, the Director of Marketing of Advanced Technology Consulting. In his role as ATC's lead evangelist, Hallmeyer is responsible for online marketing, content marketing, co-op marketing, video marketing, advertising, and public relations. Today, he mainly focuses on the betterment of all things ATC with his focus to ATC's clients and partners. ATC offers deep expertise covering 4 core areas of information technology: voice, network, cloud, and security. ATC's differentiators are clear. They have a proven consulting process. They definitely have a true attention to detail. They have an expansive portfolio of providers, and they provide unbelievable super support. ATC, I haven't been there yet. I can't wait to get up there. Recently moved into a new state-of-the-art office for technology and collaboration to accommodate their growth. Louis, welcome and tell us more about ATC. We have you on mute still, Louis. There we go.
How about that?
Perfect.
I don't think I need to say anything more. You went through everything pretty good, but you're right. We did move into some swanky new digs at Liberty Center. So I'm excited about that. And I'm sporting my ATC orange, got a little Bengals going here. I was in Kansas City on Sunday in that sea of red, and we brought home a winner. So pretty excited about that. Hooray. Anyway, to your point, we do have an awesome savings program. I think we've had the program now for 7-8 years with the chamber, and it's not a typical savings program where you say, okay, you go to Office Depot and you get 15% off. Ours is wrapped around IT consulting, so it's a little bit more complex, but the savings can be pretty significant. So the way the plan works is we offer a free consultation, and that includes an audit and assessment of all your existing services in those 4 core areas that we talked about, or that you just mentioned: voice, And when I talk about voice, I'm talking about unified communications, fundamentally business phone systems, or kind of what we're doing here, unified communications, either through Teams, Microsoft Teams, or Zoom. So we've been able to help chamber companies move to, hybrid workforces and work from home. So that's been very gratifying for us to do, to help businesses keep moving forward since everything kind of turned upside down in 2020. So voice, network, internet connectivity. So we work with companies on getting them set up with the right internet connectivity. And then one of the buckets, the third bucket, is cybersecurity. So a lot of people need to be able to, stomp out bad actors and threat actors and things like that. And a lot of times they're signing up for cybersecurity insurance, and they need different technologies and services to satisfy those policies. So we can help with that. So when we look to align the chamber member organizations with services, we're able to save them because we're a voice on their behalf, a consultant on their behalf, sometimes 25, 30, 35% than if they did DIY, right? So the savings program has been very successful over the years. I will say that it seems to fit better with the organizations with 25 or more employees. That's where the most value comes with that audit and assessment of existing services. And sometimes we can find savings right there. So I think we'll focus on the three: the voice, the network, and the cybersecurity. I have my information in there if anybody wants to talk to me about those things and the program. The consultation is a package of hours where you get our expertise and counsel on what you should be doing in these 4 core areas. The other part of the program includes, if you sign up for any technology services through us, we support those services. Everybody knows calling 1-800-SUPPORT, whomever the provider is not, heck, it's hard to get people to answer the phone. We answer our phone here, and our super support team is, again, extension of your team. So that's kind of a wrap up on the services. Thomas, did I cover everything all right? You want to bounce some ideas off me or some questions?
That's dynamite. And I think I'm glad you said that. That's the one point I wanted to make at the end, because when you call ATC, they're answering the phone. You're not going press this, press that. You're not in dial heck there. You are talking right to somebody, and they're so dynamite in following up and being there. And when you if you go on and read their comments from the people they work for and work with, it's just amazing to hear. It's like they hold your hand through these difficult decisions, and there's so much information, and there's so many businesses trying to get over on you. ATC really holds your hand through that process, making recommendations so you get the best service. They do fantastic work, and I do encourage you to connect with them and sit down and talk to Louie and the team there and find out how better you can improve and upgrade your system. So thank you, Louie, and the ATC team for your partnership. Reach out to them if you have any questions. Please let me know in the chat. Thank you, Louie. Love the hat. Thank you. Joining us now is our very own Megan Liebenow. Now, Megan is doing double work. She's leading the behind the scenes today on the program, and she's also going to speak to us about the new programs happening at the Chamber. Megan graduated from the University of Cincinnati with a BA in political science and joined our team as the Leadership Center coordinator just this past August. Megan is the program lead for our newest addition to our Leadership Center offerings, and it's called Cincy Lead. Megan, tell us more about Cincy Lead and what else is happening at the Leadership Center.
Hi, Thomas. Thank you so much for the introduction. So we're very excited to introduce Cincy Lead. Cincy Lead is a 5-course program designed to help leaders build meaningful professional relationships and become stronger leaders in their organization. Participants are assigned to a specific small group for the entire program to create a trusted group of confidential advisors. Participants will also learn from content experts and share best practices within their small groups. It's going to be really fun. Again, it's kind of an accelerated course, only 5 sessions, shorter than most of our other programs, also in a lower price point. So it's awesome for leaders who may be paying for themselves or can only get so much support from their organization. So we're really excited to offer it. Applications close on February 18th, and we're still looking for some really awesome candidates to come forward. So if you have anyone in your organization in the early to mid-career range who are rising through their organization, looking for new leadership positions, please feel free to contact me. We would love to have them. In addition to Cincy Lead, we also have applications open for Building Cultural Competence right now. Building Cultural Competence is going into its 8th class. We've been offering this for the past few years, 2 sessions a year. Participants in Building Cultural Competence embark on a journey of self-discovery and become a leader of change. It's a leadership development program that equips participants with skills to build bridges across cultural, political, and social divides in our region and our country. As a participant, they widen their perspectives and deepen relationships of others and of themselves, and help them grow into more effective leaders capable of embracing change as a competitive advantage and leading a cultural shift within their own organizations. We're very excited about this. We are still partnering with Priya Klosek. She's just wonderful. My colleague, our colleague with Thomas, Devonna Stripling runs this program, and applications for this program close on March 11th. So we've got a little bit more time for that one. They are still looking for awesome candidates as well. So again, if you have anybody in your organizations who would fit well in either one of these programs, we are happy to speak with you, speak with them. We're just, looking for awesome people to put through. Back to you, Thomas.
Terrific. Thank you, Megan. Thank you for your passion for the region, all your hard work. Megan mentioned herself and Devonna Stripling. We've had some really great hires the past 6 months at the Chamber, and those two happen to be 2 team members that are really helping us take the Chamber to the next level. And as we progress through the year, you're going to hear from some of the other new team members that we're really excited about. So thank you. So a couple things in closing. I want to give a reminder to save the date for the following things coming up at the Chamber. We have the Greater Cincinnati Safety Council on Wednesday, February 9th at 2:30. Make sure you save the date. We have the second part of Humana's webinar, Go 365 Renewal 101. That's Thursday, February 10th at 9 a.m. We have the third installment of Cybersecurity with Oswald, Incident Response Plan. That'll be Thursday, February 17th at 8:30. And as Jill alluded to, on Thursday, February 24th, the granddaddy of all, the annual dinner at the Chamber. So I'll make sure that I'm looking forward to seeing you all there. And finally, on March 3rd, we'll have our next installment of the monthly member briefing. And on March 3rd, you're going to hear from the president of the University of Cincinnati, Dr. Neville Pinto. So we're very excited about all. Chamber's got a lot going on in February, and I know everybody has a lot going on. That's why I just want to make sure you save the date, pass them along to your team. If you can't make it, make sure somebody from your team or multiple people from your team are here getting these informative events. I look forward to seeing you in person and virtually on the events. Please be safe on the roads as this weather comes into the tri-state, and thank you for your time, and enjoy the Super Bowl. Thank you.